Hello and welcome to NJBIZ Conversations. I'm your host, Jeff Kanaj. My guest today is Shlomi Madar. He is the CEO of SpotitEarly, which is a cancer diagnostics company based in Englewood. Shlomi, welcome.
Thank you so much for having me on.
Thanks for joining me. I really appreciate you taking the time. Now, we met at the Bio Partnering Conference earlier in May, and I was fascinated by what your company is doing, which is using dogs' apparent abilities to recognize cancer in humans as a screening tool. And I should tell you that everyone I've described your company to has been fascinated by it, and everybody wants to know more. So first of all, I want to start with the canine part of the equation, and that is about the science that's involved with dogs and cancer. I think I, like a lot of people, have heard that, but I wasn't really ever sure that it was an actual thing. Apparently it is a thing, and you're working on it. What can you tell us about how that came to be, and what you know about dogs' abilities to do this?
Sure. So thank you for that question. I think, first of all, intuitively, we know that dogs can help us sniff almost anything, right? We see them at airports, police force, military, so multiple applications where they have to sniff out, say, drugs or explosives or even missing persons. Just think about that. They are given just a piece of cloth and they can sniff a person from miles away. So I think we all have intuition that there's something there, but also there's science behind it.
Mhm.
So there's a body of evidence that's been growing in the last 15 years, showcasing how dogs can sniff cancer at a high level of sensitivity across multiple diseases, but with a strong emphasis on cancer. What we decided to do is to lean into that and try to really standardize the way dogs are sniffing cancer by introducing a lot of protocol engineering and, most importantly, technology. So we combine these amazing capability of dogs to sniff out really trace amounts of cancer in the sense of early detection. That's what you get. When you combine it with machine learning and advanced AI, you can really push the limit of the sensitivity of those tests.
Okay, and I want to talk about the technology that you're using in a second. But first of all, I'm curious as to what is it that dogs are sensing? Is it? I mean, it sounds what I'm telling people is that they use their sense of smell. Is that what they're doing? They're smelling cancer cells, or can something else that a tumor or a cancer cell gives off? What is it that they do? We know what it is that they're sensing.
Yes, so there's something called volatile organic compounds.
Okay.
So these are what you would call the smell molecules, and they are secreted in our bodies regardless of disease. So multiple processes that take place in our body are translated into the blood, from the blood to the lungs, and they are then secreted as those volatile organic compounds. They are called VOCs in short, and that is what the dogs are actually sniffing. What's unique about the dogs is they have a combination of software and hardware. So the hardware part is where they have hundreds of millions of olfactory receptors that are located in their nostrils. And on top of that, they have a software, something called the olfactory bulb, which is located in their frontal lobe, that allows them to really process all these kind of influx of scent molecules and really decipher in real time between the signal and the noise. And once they're trained to sniff something, even if it's in trace amounts, as I mentioned, in part per trillion, that's kind of their level of sensitivity, they can parse out the signal. In our case, it's cancer.
Okay, so let's talk about how this works then. First of all, the dogs, are you training them to do that? Does your company train them to do that, or do you have dogs who are already trained to do that?
So we start off, that's a great question. We start off with sniffer dogs. So
Okay.
it's not any regular dogs. There are a bunch of breeds that are specializing in sniffing. It has something to do with their demeanor.
Okay.
And then they undergo training at our facility. So we want to make sure that they pass a certain test. And then once they qualify, they start the training process, which can take on average between 4 to 6 months.
4 to 6 months. Okay. So as I understand it, this is an at-home test, or at least it starts as an at-home test, where an individual gives you a breath sample. Am I right about that? Have I got that right?
Yeah, it's a very simple like N95 mask where you have to breathe into it for a few minutes,
Hmm.
and then you can take this test, to your point, from anywhere, the comfort of your home, in the clinic, wherever you have time to sit down for a couple minutes.
Okay. They do that, then they send it to you. Is that right? And then you expose it to the dogs, and then what?
So I just should mention that the test is not currently available
Right. I should. Yes.
for
Okay.
sale, but
Let's make that clear.
yeah,
What we're talking about is in development, and we'll talk about some of the results for the trials you've had later. But I just want to see how it, if it does get to the point where it's in practice,
sure.
how would it work? So give me a sense of that.
Yeah, of course. So once you bring it to the max, you put it in the capsule, you ship it to the lab, a very easy, simple process. The journey of the mask begins at the lab.
Hmm.
We have all the engineering to take the mask, produce gas in a very measurable amount, and introduce it to the sniffing ports where the
Okay.
dogs would interact with the scent of each sample. Each sample is being sniffed multiple times and by the entire pack, which includes 3 to 4 dogs. So we have a lot of redundancy.
Okay.
And now the entire lab is monitored. So we have multiple sensors. We have accelerometers, sensors that measure the heart rate, cameras that would look for any deviation from the routine behavior of the dog. We have cameras inside the sniffing ports that can actually capture those facial gestures of
Okay.
the dogs. So all this plethora of information is being fed into the machine learning, and then it can make a decision whether or not a certain sample is positive or negative.
Okay, so you mentioned machine learning. AI is a big part of this. Yes, artificial intelligence. A, first of all, what do you use it for? And B, would any of this be possible without it, without the way it's developed up to this point?
So as I mentioned in the beginning, you have a lot of raw data and other studies where you can see dogs sniffing cancer. But the main point here is to make it standardized and stabilize the platform
Mhm.
so you can have reproducible results. And this is where our technology really comes in. By
Okay.
the way, we call it the Lucid platform
Okay.
because it controls the entire process. So you have the dogs, they are the trained sensors, if you will. They are big part, important part of the equation. But of course, you cannot do it you cannot standardize this process without the use of technology, both on the engineering level and on the AI machine learning piece. That again, once you feed it with more and more information, it actually gets better with time.
Okay. All right. So AI is then watching what you have cameras, you said, that's watching what the dogs do, and AI is interpreting those behaviors or watching them, comparing them to what you already know about how dogs would respond to what they sense, what they smell. Is that right?
Yes,
Okay.
exactly.
All right. So in other words, someone who, like our dog, if we wouldn't be able to recognize anything if she happened to sort of smell something that was wrong with us. We wouldn't. It would probably mean nothing to us because we have no point of reference.
So it would be hard to know whether they're gesturing for one thing or the other. Whereas when you use trained dogs, they typically show a gesture,
Okay.
which is sitting in our case. But even then, there are some subtleties. Did the dog sit for 2 seconds or 3 seconds? Was their heart rate the same as usual? So there are certain giveaways that the human eye is just not
Right.
trained
Okay.
to really understand what the dog means by that behavior.
All right. So so then I was sort of alighting over one of this. The first part is the training the dogs. The second part is then watching what they do, so that you can record what they've been trained to do.
Yes.
Okay. Now I mentioned at the top that you do have some trial results. As I understand, you have four fairly common types of cancer that you're working with now: lung cancer, breast cancer, colorectal, and prostate. And you've had results that show. Well, I'll let you tell me about the results. I know that you have some essentially 93 to 94% of what you're seeing. What do those results mean? What did you see?
So yeah, we ran a clinical study in Israel, which included 3 medical centers. It included 1,400 patients in both arms, so cancer-free and cancer-positive patients. And we trained the dog to sniff 4 types of cancer, as you mentioned.
Mhm.
4 of the most common ones. Between them, they account for around half of the newly diagnosed cancers in the U.S. And then we obtained around 94% both sensitivity and specificity, which is exactly what you want. You want to make sure that you have lower rate of false positive and false
Right.
negative.
Mhm.
And even more than that, we excelled at the very early stages. So when you look even deeper into the results, stages 1 and 2, the dogs actually did better than for the entire cohort, which goes to show that for the purpose of screening, for early screening, which is where you want those patients to be diagnosed, our test is actually doing fairly better than any other
Really?
traditional test.
Wow, really? That's interesting. Because I wouldn't. I mean, I would think that at this point, from where you are, that you would still be sort of lagging behind. But it sounds like you're actually, you're saying that you're doing better than say blood tests or urine tests or things like that.
Yes, I should mention though that now what we're trying to focus on, so that was a horizontal pack,
Okay, right.
which is trained to sniff multiple cancers. Now we
Okay,
want to make sure that we can focus on one cancer at a time. So
okay,
we are training vertical packs that can sniff out a particular cancer to the exclusion of others. And we're going to start off with two cancers, breast and lung,
hmm,
which is what we're currently focusing on in terms of the clinical studies in the US. So it's very
okay,
important. US is going to be the primary market for us, that we deal with the relevant cohort, with the relevant population. And this is exactly what we're planning to do in the coming weeks and months.
okay. Well, you anticipated my next question, which
Oh,
was
I'm
where you
sorry.
go from here. That's fine. Where do you go from here, and what do you think the market is? So, where do you go from here? You're as you say, you're focusing on these two cancers. How far are you from being able to go to market and say we can do this?
Great. So, as I mentioned, I want to follow up on the clinical studies. We
Sure.
want to do them in the US so we can
Okay.
substantiate the results that we've seen in the study in Israel. Once we get interim results, so kind of halfway through the clinical studies, we'll be able to introduce this test into the market. We have a CLIA registered lab. So, this is something that we're allowed to do. In parallel, we're still planning to pursue FDA approval for multiple purposes, for reimbursement. Typically, you run a much bigger study when you engage with the FDA. So we kind of, we're working on a multi-layered approach to go to the market.
Okay. And so, but eventually, even if you get this to the point where you're confident that it works and can go to market, you're going to have to do this at your place. Like this is not something that can be set up at a hospital, for example, or a physician's practice. You really need to have the kinds of stuff that the dogs themselves, and the technology that you have in your lab.
That's true, but we also standardize the technology. So basically, we can open another lab now, much faster than the first one.
Mhm.
We received a grant to open a lab in the US together with the University of Pennsylvania. So this is something we're hoping to kick off soon. And we can actually, in the future, license this technology for other labs to use. Obviously, they will have to deal with the trained dogs, but we have the protocols, we have the technology established. And in the even far future, you can basically, for any lab that uses dogs to sniff anything, our protocols would be valid.
Okay. And I'm curious that you mentioned the way dogs are can help humans in other ways too. Are there any other applications that you can see for this kind of technology? I'm thinking particularly of search and rescue. Obviously, you can't take your lab out to a to a disaster site, but you just using AI. Is there a way to kind of help humans observe and interpret what dogs are seeing?
Yeah, that's a great question. So I would say, I mean, the closest circle would be just covering, more cancers. And
Right.
then if you go a circle beyond, it would be other diseases, right? And there's a lot of kind of reports that you hear from people who had neurodegenerative diseases where the dogs were showing some, behavior that was different than usual. And they think it might be related to early detection of those diseases. So we believe that you can train dogs to sniff basically any other medical
Ah,
condition. We have to
okay.
focus as a startup on cancer, but we
Right.
cannot rule out other conditions. And then to your point, basically sniffing anything that has a unique scent. So we believe we can help police, military applications, airports, for example. Remember, they need
Right.
less than a second to
Right.
clear
Right.
up any sample. So this could be a very standardized, stabilized system that can help you do it more reliably.
Okay. All right. Let me talk a bit about the company. You mentioned that you had a grant. I know you've had some investors. Are you still looking for investors? Are you mostly looking for grants? Are you looking for investors or partners? Where are you in terms of how you're going to get the company to where you want it to be?
Sure. So we currently seeking partners.
Okay.
We have a few that we're about to announce in the coming months as we're kind of in the final stages of
Oh,
contracting.
make news now. Tell us.
Unfortunately, I'm bound by the contract,
Okay.
not to reveal it yet, but I'll be happy to be in touch later
Okay.
on.
Good.
But there are some household names, health systems in the East Coast, and we're, very proud to even be in this type of conversation. They see a lot of potential in us, and they wish to join forces. So hopefully this will come out soon. In terms of fundraising, so we raised $20 million in seed funds, and now
Okay.
we're embarking on round A.
One day. Okay.
And this is going to be open for both accredited investors and in the near future to Main Street investors as well, because we believe that our vision, our dream is really saving lives across the board. This is something that anybody can relate to, and we want to make it possible for anyone to join our journey.
Okay. And I have to ask, what brought you to New Jersey, and what's it like doing business here?
So I moved here around 9 years ago
Okay.
with one of the startups that I work for. I find New Jersey to be amazing. I'm raising my kids here. It's an environment. First of all, it used to be called farmland.
Mhm.
So for my line of business, obviously it
Right.
was
I should mention you do have a background in pharmaceuticals and healthcare, so you're coming to
yeah.
this from that side of it. So welcome to New Jersey. Go ahead.
Yes, no, for sure. But also, just it's really fostering innovation. So there are multiple agencies who try to support, bring together like-minded people, investors and entrepreneurs, big companies, small companies, health systems. So it's anyone who's, willing to kind of go a little bit different than you have the big hubs right in Boston and San Francisco. I think don't dismiss New Jersey. It's a great place to do business, specifically for healthcare. I've enjoyed, and I can attest to that because I'm here for 9 years. So if you want to enjoy your life in the suburbs and also focus on growing your healthcare company, New Jersey is the place for you.
Okay, that is going to be music to the ears of a lot of people I know. So thanks for that.
Of course.
Finally, before I let you go, I mentioned the BioNJ at the top. I'm curious as to what you thought of the conference, the event, what you got out of it, and what you think of BioNJ as an organization. Tell me a little bit about the conference and what you accomplished there, what you thought you were going to accomplish.
Sure. So to me, it was my first BioNJ, but it was very interesting. So starting off with kind of the open remarks and
Mhm.
kind of giving like the lay of the land for healthcare. So I know there's some volatility in our space right now, but also what I think came out of from the numbers was the fact that we do see some positive trends in terms of deals, investments, which typically reflect also
Sure.
kind of the state of the union for
Mhm.
innovation in healthcare. Recent developments, we'll have to kind of wait and see how they're going to impact the entire ecosystem, but there
Right.
are reasons to stay optimistic.
Okay.
And I think that, the speakers in the conference reflected that well. Other things that I've seen is just innovation across the board, really smart ideas across multiple medical conditions, which is always fun to see because we're getting older and we were
Right.
gonna need all this ingenuity in healthcare. So this was something that I enjoyed listening to other companies as well. For me and for my company, this event was very useful on multiple fronts. So first of all, I engaged with multiple people for a clinical collaboration, and hopefully something will come out of it. We're already in advanced conversation.
Oh, good.
Also, multiple investors who kind of saw the potential of the company, and also now we're having follow-up conversations. So for the company, specifically SpotitEarly, that was a great event.
Okay, well, good luck with all of that. Shlomi Madar, CEO of SpotitEarly, the cancer diagnostics company. Thank you for joining me. I really appreciate you taking the time, and I hope you'll come back and tell us a little bit more about how the company is developing.
Oh, I plan to, and thank you so much for having me on. Appreciate it.
Okay, thank you very much, and thank you all for watching. Until next time, stay safe, everyone.